Good day, everyone. We are here today to present to you our research proposal. And let me introduce myself and my co-members. I am Kayabyab Ibon Carlo, and here is Ms. Valdez, Ms. Bernal, and Mr. Luanson. Our research proposal entitled Investigation of Spreading of Coronavirus or COVID-19 through Water Contamination. Here are some points of the discussion for Chapter 1. Background of the study, statement of the problem, objective of the study, significance of the study, and conceptual framework. And for Chapter 2, there is a review of related literature. For Chapter 1, background of the study, the COVID-19 outbreak was declared a pandemic in March 2020 by the World Health Organization. The coronavirus or SARS-CoV-2 is a new virus that we haven't seen before that can cause a respiratory infection, or some do causes a diarrhea, loss of smell, and taste. As a total number of deaths worldwide exceed to 1.2 million and 49 million of active cases were reported to date. So the Philippines are the fifth in Southeast Asia in terms of the percentage of the active cases. So there is a total cases of 398,000 coronaviruses according to the Department of Health. So due to the mass gatherings or not applying a physical distancing is in also not wearing a mask are some of the factors why coronavirus cases are still climbing. So it is known that the COVID-19 is primarily transmitted from person-to-person contact through respiratory droplets. So when an infected person cough or sneeze, the virus can easily be transmitted from person to person. So similarly to how influenza and other respiratory pathogens spread. However, coronavirus can also survive in wastewater. So based on the studies carried out on previously identified coronaviruses, there is a chance that the SARS-CoV-2 virus may survive in wastewater. So the discharged wastewater, especially for those without appropriate treatment, would expose the public danger of infection. So the survivability of coronavirus 2 in wastewater can take hours or up to several days to achieve a 99% reduction in infectivity. So in recent months, SARS-CoV-2 has been detected in municipal wastewater, also referred as sewage, include water from household, building, used toilet, shower, and sink that contain human fecal waste.
This line graph shows the detection of SARS-CoV-2 RNA in municipal wastewater in Italy, Japan, Australia, USA, the Netherlands, and Spain by testing their wastewater to the presence of SARS-CoV-2. Countries like Spain, Netherlands, Italy, USA, and Australia has a significant percentage of their untreated wastewater positive for the SARS-CoV-2. But in Japan, the presence of the virus is non-existent in their untreated wastewater. But after going through wastewater treatment, countries like the Netherlands, Italy, USA, and Australia no longer show the presence of SARS-CoV-2 in their treated wastewater. Meanwhile, countries like Spain and Japan, even after going through wastewater treatment, the virus is still detected. Only after receiving secondary treatment, the treated wastewater tested negative. The proposed solution. Our plan on investigating the spreading of COVID-19 through water contamination is first to identify possible sources, gathering data on what elements in the water cause the existence of the infectious virus in water bodies. Next is transmission routes, monitoring where are the possible travel pathways of the virus on water system? Then, evaluate if the pathways taken by water lead to wastewater treatment facilities, then tracing the discharge of fruit of said treated wastewater, and finally, analyzing the risk that imposes public health and safety regarding the routes of possible infected wastewater. The statement of the problem. For a densely populated country like the Philippines, 4% of the population has a sewer connection. Even the most developed urban center, Metro Manila, has only 10% of its wastewater going through complete treatment, making the chance of contamination through different kinds of viruses, especially coronaviruses, extremely high.
Objectives of this study. The general objective of this research is to investigate the spreading of transmittable disease through water contamination. And the specific objectives of this research are to determine what other causes of the spreading of transmittable disease to the water and to determine possible solutions to halt the spread of the virus through water contamination. Significance of the study. The researchers believe that this study will have a contribution on the fight against COVID-19 by gathering information about the potential risk of possible virus transmission through water contamination. It will be beneficial for public health since they will utilize this as a reference to see if there is a connection of transmitting coronavirus disease to the water and wastewater system. Data produced from this study will be used to identify the possible hotspots in early stages of any disease in the environment and begin isolation and treatment process to prevent the virus from contaminating the water. The result of this research will benefit the future researcher for them as a related study or basis to their future studies. The study will provide information on which approach is applicable to effectively halt the spreading of COVID-19 and to minimize its risk in wastewater. It will benefit the families for them to know and understand the influence of coronavirus that might cause risk on their health. This research will provide data that will help the public to better understand the extent of the viral infection in communities.
The structure of the study is depicted by the figure shown in this slide. The conceptual framework has three main parts: input, understanding COVID-19, water transmission, water bodies, process, knowing its sources, detection, monitoring, preventive measures, and output, which is the safety and health of the public. In order to accomplish our objectives, we must first understand what COVID-19 is. As explained earlier, this virus can easily be transmitted from community interactions. However, the presence of SARS-CoV-2 RNA is detected in feces and sewage through water transmission. Thus, there is a possible risk of human being infected with the virus, especially when the discharge is raw on water bodies. As the transmission rate of COVID-19 continues to increase, scientists and researchers around the world are trying to come up with different means to contain and mitigate it. It is crucial to know how the virus decays in water systems to evaluate the risk. Knowing its possible source may lead to the inactivation of the virus, and the need for wastewater surveillance is necessary in order to assess and manage the pandemic. According to Dutton, wastewater-based epidemiology could play in solving some of the challenges faced in monitoring the spread of COVID-19. It was also recommended by Chaudhry as a useful tool in identifying the potential spread of the viral infection that reaches the sewage system through feces and urine samples. Therefore, if COVID-19 can be monitored at an early stage by WB and other means or process, preventive measures such as the improvement of water quality and sanitation can be taken as early as possible to minimize the virus dissemination and threat to society's well-being. Chapter 2: Review of Related Literature. Current detection of the virus in fecal samples has been mainly through RT-PCR. Others use ultrafiltration and WBE.
This table is a tabulated comparison of the different types of coronaviruses that appeared from 2003 to 2019, the SARS-CoV, MERS-CoV, and the current SARS-CoV-2. Data showed that infected individuals' stools tested positive for the virus. In the 2003 SARS-CoV outbreak, the stool survival varies from 5 to 30 days, and for SARS-CoV-2, 1 to 25 days. Also, the coronaviruses listed has the same data involving 99% reduction in wastewater depending on the temperature, projecting 2 to 3 days for 20 degrees Celsius and 7 to 9 days for 25 degrees Celsius.
It is estimated that it took 6 to 8 hours from excretion in feces to the wastewater sampling point. So therefore, the virus may have been inactivated within that period. However, based on the data from other coronaviruses and occurrence of viable SARS-CoV-2 viral particle in feces, untreated wastewater may contain some viable and infective human coronaviruses.
Research gap. Knowledge is limited on virus concentration step that will allow the extraction and detection which is required to efficiently monitor the SARS-CoV-2 in wastewater. Existing studies are not sufficient for developing epidemiological models that will map the concentrations of virus RNA found in the sewer water. Since we are currently experiencing this kind of pandemic, existing research regarding viruses in water is not sufficient. Researches regarding SARS-CoV-2 RNA existence in water is still ongoing and evolving, so this may be a research gap for acquiring a more accurate data. Former existence of pandemic viruses in water may have similarities with COVID-19, but some strain of the said virus may come with different properties.